Exploring and addressing mental health issues in our society. Since 1949, May has been designated as Mental Health Awareness Month. Decades later, this country is still working to break the stigma associated with mental illness and get people the help that they need. This is the WDSU Hot Seat. I'm Juliana Mazza. Here to talk about mental health in the New Orleans area are two psychiatrists from Tulane, Dr. Nithya Ravindran and Dr. Madeline Jansen. Thank you both so much for joining us. I appreciate it.
Thank you, Juliana.
So as you know, May, Mental Health Awareness Month, and we're trying to highlight some of the issues that are going on in the New Orleans area, things that we can do to improve. What do you think are some of the biggest challenges that people suffering from a mental disorder are facing in this area right now?
So I'd like to thank you for addressing this issue. It's very important to us, obviously. I think some of the challenges that people face are access to health care, in general, finding providers, finding the best help in the city. And I think it's really important that people do, find a doctor, find a psychiatrist if they're going through some mental health issues, so they can better address it. But sometimes finding that doctor can be really difficult in the city.
And I guess what are some of the recommendations? I mean, a mental health disorder is such a broad term. There are so many different forms of a mental health disorder. It can be hard for people to figure out where they turn to help their specific need.
Mm-hmm. So it is broad. It can cover things like depression, anxiety, as well as things that we classify as severe mental illness, which are things like schizophrenia, bipolar disorder. So depending on what is going on, you kind of have to figure out what best help that you can get for your person or for yourself. The internet is a good option, or sometimes people find help in going to the hospital or going to the ER sometimes too.
And Dr. Jansen, something that comes even before finding help is recognizing that you may need that help. Are there any recommendations or signs that people should be looking for? Again, I know mental health is such a broad term, but what should people be looking for?
So with mental health, the thing that's really important is that you have a problem, that these symptoms cause problems with your functioning. So with a lot of mental health disorders, the symptoms are things that people can experience without having a disorder. But when those symptoms cause you to have impaired functioning, that's when you should probably think about getting help.
And a mental health disorder, I mean, this can develop at any point in a person's life. This isn't necessarily something that you've been experiencing since childhood.
Yeah, well, definitely life stressors can make certain things worse. And so being aware that, stress can exacerbate any medical condition. So mental health is no exception.
And there are things that come about in childhood more so than adult patients that we see. A lot of times the transitional age is particularly tough, so going from high school to college or adolescence to adulthood, we see a lot of disorders, a lot of mental health issues come up in that time. It's just the way that the brain is changing around that time, as well as, like Dr. Jansen said, some of the stressors that come with it, going off to college, being by yourself, being independent. So most of our disorders that we treat come about in that age, but it can be childhood and adults too.
And when we're talking about childhood, I mean, oftentimes at that stage in life, it's the parents who are responsible for trying to identify these signs or symptoms and then getting their child help. Do you think sometimes in those stages of life where the brain is developing, it can be hard for parents to differentiate? I don't know if that's ever an experience that's tough for them to go through.
Yeah, I mean, adolescence is a time with a lot of changes, so it's hard. It can be hard as parents to know whether or not these are normal teenager changes or whether or not it represents a bigger problem. So, talking to your pediatrician and letting them know of the changes that have been happening, they can usually give you an idea of where to go after that.
And I want to talk about breaking the stigma, because we've come such a long way over the last several decades, but we still have a long way to go. this stigma that surrounds mental illness oftentimes makes people feel isolated and feels like they can't express themselves, which can be detrimental to them getting the help that they truly need. So how important is it that we try to break this stigma, and how do you try to go about doing that?
Yeah, definitely. We still face a lot of stigma in our profession, and our patients definitely feel that too. I think awareness is important, education, starting from school, you know, teaching kids what things to look out for in their peers, or even, you know, school teachers looking out for things in their kids. You know, just starting out with early education about symptomology, about decline in functioning. I think part of decreasing stigma is also understanding that these are illnesses like any others, like diabetes or hypertension. It just affects the brain. So, you know, there's no reason for that to be in a different category in itself. I think the field overall is moving towards a global medical definitions of these mental health issues.
And if you look at where we were decades ago, it seems like we've made drastic changes and we've progressed so far. Like I said, if you compare to, you know, where the country was years ago.
Definitely, yeah, and there are lots of good organizations doing good work to alleviate some of that stigma. NAMI is especially one of them. Doing things like public awareness, public outreach can be really important to alleviate some of that stigma.
I think it's important to note too that a mental health issue or disorder can affect any kind of person. It's not specific.
Yes.
Which is important.
Definitely, and it's universal. It's, you know, not just something in the United States. It's global. Affects all different races, ethnicities, ages. Definitely.
So now let's talk. I mean, once you have identified that someone may or may not need help, especially when we're looking specifically at teenagers, I think, you know, with all the horrific things that we've been seeing going on across this country, it's been promoted so heavily that if you see something, you say something. How important truly is it for kids if you maybe see something or someone that could be a little off, or something that strikes you as a little odd, to make sure that you do speak up?
Yeah, definitely. I mean, you don't want to wait too long until it's too late, of course. So early intervention, early detection, for most of the illnesses that we treat has been shown to have better prognosis overall in that person's life. Because again, like you said, adolescence is such a critical time for a lot of these kids. You don't want to remove them from the trajectory that they're on, school-wise, occupation-wise, socially too. So, you know, early intervention is key there.
And once those maybe signs or symptoms have been identified and someone's trying to take that next step to look for help, what is the best resource? I mean, is turning to the internet truly the first step that people should take to start doing research?
So I wouldn't recommend going on WebMD and researching symptoms. We have a lot of people come in and saying this is what I have based on these things that they've researched. There are good resources out there. Again, the NAMI website is a great one to go to. You can look at symptomology, you can get information on what might be going on, as well as resources to area help that's out there. There are other things. The NOAA.gov website has a mental health resource guide that can be really useful. It breaks down clinics and hospitals by who takes what insurance, what age group they treat. So that can be a really good resource as well.
And oftentimes too, when people are taking those first steps to get help, it can be a little confusing, trying to figure out exactly which direction you should turn. I know you both are based in the New Orleans area. Do you think in this area that we do have a good amount of resources, or do you think that we could still try to make improvements in what's available and what help exists?
Yeah, I mean, I think there are lots of good people doing good work in the city. It's a matter of connecting those people that are seeking help to those people, and especially, you know, I think it can be a struggle sometimes with depending on insurance, and if you don't have insurance or are underinsured to get those kinds of help. But you know, I think there's always room for improvement. People, you know, seeking help and also finding that there can be a lot that could be changed, and more people working in the field definitely helps with that. So
And Dr. Ravindran, I wanted to ask you, I know you're part of a program that focuses on early detection. Can you talk to me a little bit about what you are focusing on right now?
Yeah, I work in Dr. Ashley Weiss's clinic called EPIC, which is Early Intervention, Early Psychosis Intervention Clinic. So what we see there are young people between the ages of 15 and 25 who are experiencing their first episode of psychosis. So psychosis can be really scary, can be really detrimental for people's trajectories in life, so socially, academically, occupationally. So, you know, broadly speaking, psychosis is just a loss of touch with reality, so hearing voices or feeling paranoid or, you know, perceptual differences as well. So those things start in adolescence, like I mentioned, and it can start pretty insidiously. It may not be full on hearing voices, it could be just not quite, you know, connecting things right or thinking clearly, and sometimes it does manifest in a decrease in school functioning because they're so distracted or unable to kind of focus on what they're doing in school. So, you know, we see people in this clinic and kind of start treatment right away to kind of alter that course. And studies and research have found that that improves outcomes overall. And in our clinic too, we've found that rehospitalization rates are at the national aspirational levels, so we've definitely made some big impact on that. So.
Congratulations.
Thank you.
And my last question, I'll ask both of you. Dr. Jansen, I'll start with you. When addressing and trying to connect with people who are suffering from mental illness, I think it's so important that they understand that they truly are not alone. For anybody who is watching this program, what's the message that you would like them to know?
Yeah, just sort of what you said, like you're not alone, and help is there, and if you need it.
Dr. Ravindran?
Yeah, definitely. You know, help is there. I think it can be really isolating, like you had mentioned, to deal with some of these things, and especially feel like you're alone in dealing with them. And on top of it, the stigma of reaching out and admitting that there might be something wrong is really difficult for a lot of people to do. I would recommend, if you feel like there's no one in your family that kind of understands, or your friend group, just to go research, like on the websites that I'd mentioned, and try to seek some professional help. It can be really refreshing for a lot of people that first encounter with someone in the mental health field, just to see how many people deal with this, and you know, we try to normalize the experience and just, you know, help them out with what they're dealing with. So you know, the worst thing you can do is kind of keep it to yourself and have things get worse. So definitely reaching out is good.
Dr. Nithya Ravindran and Dr. Madeline Jensen, thank you so much for coming on our program. We really, really appreciate it. And for one quick second, if you guys take a look at your screen, here's some information on a fundraiser at Body Be Fit that's going to help people suffering from mental illness. All that information going up on our website as well, WDSU.com. Stay with us, everyone. We'll be right back after the break.